Hi, let's see an NCLEX RN video based on assessment of immune system. You know that immunity refers to the body's ability to resist infection and disease. There are two types of immune responses. One is innate or natural immunity and the other one is acquired or adaptive immunity. You need to also know about the different structures or organs which are part of the immune system. So the immune system consists of, first one is the lymphatic system, which includes the lymphatic vessels and the connecting ducts. Second one, or the primary or the central lymphoid organs, are the thymus and the bone marrow. The secondary lymphoid organs include the spleen, lymph nodes, tonsils, adenoids and Peyer's patches, which are found in the mucosal lining of small intestine. So that is the secondary or peripheral lymphoid organs. Fourth one, cells in immune response, which includes the leukocytes or WBC, T and B lymphocytes. Then there are the antibodies. Antibodies are also known as immunoglobulins. You know that there are mainly 5 classification of immunoglobulins. They are IgA, IgD, IgE, IgG and IgM. IgA, you know that it is found in the breast milk and tears. IgD, they help in B cell activation. IgE is associated with allergic reaction and parasitic infections. Then immunoglobulin G, that is effective against bacteria, virus and other toxins. And IgM, it is the initial antibody that is produced after an infection. So this is about the cells in the immune response. Then there are the proteins which are known as the cytokines. They include interleukins, interferon and tumor necrosis factor alpha, TNF alpha. So these are all part of immune system. Let's see the first question. The nurse correlates diminished adaptive immune responses with which of the following? Select all that apply. Is it a decreased peripheral B cells, decreased antibody response, decreased peripheral T cells, decreased phagocytosis capacity and decreased eosinophils? So here the question is asking diminished adaptive immune responses. You need to know that immune responses are two, innate or natural and acquired or adaptive. In this innate or natural, it comes the first line and second line of defense. The first line of defense include the physical barriers, biochemical barriers and mechanical barriers. And if you talk about the second line of defense, that is the inflammatory response by the phagocytes and the eosinophil production. So this first line and second line will come in innate or the natural immunity. So here it is asking adaptive immune response. The adaptive or acquired immunity, that is also known as the third line of defense, which is classified into natural and artificially acquired. Naturally acquired is through infection or from the mother to the child through the maternal antibodies, and the artificial one is through vaccines and also passively through the immune serum. So here the diminished adaptive immune response is correlated with decreased peripheral B cells, decreased antibody response, decreased peripheral T cells. These are all involved in acquired or adaptive immunity. And this decreased phagocytic capacity and decreased eosinophil, phagocytes and eosinophil production, they are associated with innate immune response. Next question, the nurse includes which of the following in the past medical history evaluating the immune responses? Select all that apply. Is it a recurrent infection, chronic illness, dietary history, history of fractures, medication history? So when the nurse is checking or evaluating the immune response from the past medical history, what all things she will understand? One is if the patient is having a recurrent infection, that shows there is some problem with the immune system. Some immune dysfunction is there. If the patient is saying the patient is having chronic illness, that also shows there is some immune dysfunction. Then if we are taking the medication history at that time, if the patient seems to have taken chemotherapy or on steroids, that also may decrease the immune function. So when the nurse is collecting the past medical history, anything like the recurrent infections, chronic illness or medications like chemotherapy or steroids the patient is telling, that means there is some immune dysfunction for the patient. Nothing is related with the patient's dietary habit and the history of fracture with the immune system. Next question, the nurse understands which of the following is an important component of the innate immune response. So the innate and the acquired I have already told, or the adaptive. So the innate includes the first line and the second line of defense, which is the natural immunity. So it includes the physical barriers, biochemical barriers, mechanical barriers and inflammatory response. So here when you see skin, skin is a physical barrier, so that is, or it's a mechanical or a physical barrier we can tell to protect against infection. So skin is something which is related to the innate immune response. B and T cells, we know that they are part of the acquired immunity, and teeth has no relation with this immune response. The nurse understands that immunity acquired by an infant through his or her mother is an example of which type of immunity. So is it a cell mediated, humoral mediated, adaptive immunity or passive immunity? So here from the mother to the baby has got some immunity. It is not B cell or T cell related, so it's not cell mediated or humoral mediated, and it is not an adaptive immunity, we can tell. It's a part of adaptive immunity, but directly we can't tell it is adaptive. We can tell it is a acquired, naturally acquired passive immunity. Naturally acquired passive immunity. The central lymphoid organs include which of the following? So here you need to know that what are the primary or the central organs, what are the peripheral organs or the secondary organs. So the organs are, here the central lymphoid organs include whether it is spleen and tonsils. So spleen and tonsils comes under the peripheral. Bone marrow and lymph nodes. So bone marrow is central and lymph nodes is peripheral. So that answer is wrong. Thymus and Peyer's patch. Thymus is central. Peyer's patch is its peripheral. Thymus and bone marrow, they both are central or primary. So that is the answer. Which of the following cells are classified as granulocytes? Select all that apply. So here you need to know what are granulocytes. So here you need to know the leukocytes or WBC. They are classified into 5 types. They are the neutrophils, monocytes, eosinophils, basophils and lymphocytes. That lymphocytes includes B and T cells. So these 5, they are classified also as granulocytes or agranulocytes depending on their functions also. Granulocytes have granules in the cytoplasm and they release histamines and other substances to defend the body against foreign materials. These include the neutrophils, basophils and eosinophils. And agranulocytes, they are without granules in the cytoplasm. They include the monocytes and lymphocytes. So here let's see what are the granulocytes. Is it basophils, monocytes, neutrophils, eosinophils, lymphocyte? I already told the neutrophils, the basophils and eosinophils, these three are coming under the granulocytes. They are the part of WBC, but they are known as granulocytes. And the other two, the monocytes and lymphocytes, they are also part of this leukocytes, but they are agranulocytes. Which statement by a patient undergoing a bone marrow biopsy indicates a need for additional teaching? My lymph nodes are enlarged because of my immune system disorder. I might need something to calm my nerves before having this biopsy. Odds are that I will die from this procedure. My biopsy result may show that I have a problem with my immune system. So, bone marrow biopsy, usually it may reveal leukemia and all. The lymph node enlarged with immune system disorder. So, the first answer is a correct thing which the patient is telling. Then, second one, the need for bone marrow biopsy may cause anxiety that necessitates the need for any anti-anxiety medication. So the second one, they need to calm my nerves before this biopsy. That option is also correct when the patient is saying. The third one, odds are that I will die from this procedure. This is a wrong statement. Here the patient don't have that much risk of death. So this statement, if the patient is making, the patient need further education. And the last one, the biopsy result shows the problem with immune system, especially leukemia and all, we are ruling out with that. So the wrong one is I will die from the procedure. If the patient is saying, of course we need to teach them further. Next question, which of the following diagnostic test is drawn to assess the cellular immunity? Select all that apply. Total Ig or immunoglobulin levels, specific antibody response, total lymphocyte count, helper T cell functions, complete blood count. So, to assess the cellular immunity, what all diagnostic test you will be drawing? So here you need to know that the lymphocytes are divided into humoral and cell-mediated immune response. This humoral immunity, it is related to the B cells and the immunoglobulins or the antibodies. And the cell-mediated immunities that are related to the T cells. And T cells include, you know that there are the cytotoxic T cells are there. Then there are the suppressor T cells and the helper T cells. So the answer for this is the total lymphocyte count. If we are checking, that shows both cellular and humoral. So if we are checking for this total lymphocyte count, that is a diagnostic test that will assess the cellular immunity and humoral immunity also. Next one, the helper T cells. You know the T cells are related to the humoral, the helper T cells are the T cells are related to the cellular immunity, and the T cells include the cytotoxic, suppressor and helper. So helper T cell functions also. The total immunoglobulin levels and specific antibody response, they are both related to the B cells or the humoral immunity. And also when we are checking a complete blood count, that evaluates the body's response to the inflammation and infection, and it as a part of innate and humoral immunity. The nurse associates which of the following findings to immunosenescence in a 68-year-old woman. Here you need to understand what is the term immunosenescence. Immunosenescence refers to those changes that occur with aging and their consequences like increasing infection risk, increased risk of malignancy, increased autoimmune disorders. So here the patient is 68-year-old woman. So what all findings will be there in immunosenescence? Is it a pneumonia? Is it shingles or cervical dysplasia? Is it cancer or arthritis? So of course, pneumonia, cancer, shingles, arthritis. So these four are related to their decreased immune response in the elderly. Cancer, pneumonia and arthritis, they are more common in elderly, and shingles is also common in the elderly as there is an increased risk of viral infections because of the atrophy of the thymus gland. Cervical dysplasia is not related to the immune system as such. So, elderly patient female presents to an urgent care clinic with a 4-day history of low-grade fever, malaise, headache, and itching and painful sensation on the right side of her chest. She states that she has stopped exercising due to the discomfort and finds tight clothing to be irritating. Her maximum oral temperature has been 100.4 degrees Fahrenheit. The patient denies weakness, dizziness, confusion, difficulty swallowing or breathing problems, or there is cough, nausea, vomiting, diarrhea and weight loss. She also denies exposure to ill individuals or recent travels. The physical examination of the patient shows vital signs as a low-grade fever with a temperature of 100.2 degrees Fahrenheit, heart rate of 88 beats per minute, blood pressure reading of 128 by 82 mm of Hg. Her examination is significant for an erythematous macropapular rash with several vesicles on the right upper chest. She was diagnosed with herpes zoster or shingles. Herpes zoster is a reactivation of the chickenpox or varicella zoster virus that can result in post-herpetic neuralgia. The nurse practitioner instructs patient to increase her fluid intake and avoid exposure to individuals who may be immunosuppressed. She is instructed to immediately report if she develops increasing fever or pain. She will follow up every 1 to 2 weeks until resolution of her symptoms. So here we come to know that this patient is a 60-year-old female and she has got fever, malaise, headache and itching and painful sensation on her chest. Then doing the physical examination, the nurse found macropapular rash with vesicles and she is diagnosed with herpes zoster or shingles. So now the nurse has told the patient to increase the fluid intake and avoid exposure to immunosuppressed patients or the other individuals. So let's see the questions which are following this case. The nurse caring for a patient with herpes zoster or shingles incorporates which nursing diagnosis into the plan of care? Is it risk for bleeding? Is it persistent fatigue? Is it pain or inadequate nutrition? So the patient with shingles or the herpes zoster, they will be having pain as the most common presenting symptom. The nurse monitors for which advancing clinical manifestations in the patient diagnosed with shingles. Select all that apply. So here what all things when we are seeing in the patient, we have to further inform the physician. So here is it a worsening pain, high fever, malaise, nausea and headache. So when the patient is having worsening pain and fever also, it should be reported to the physician because further evaluation and treatment may be required. The malaise, nausea, headache, they are common symptoms and it should ease as the infection runs to its course. So we need to see or monitor for the worsening of the pain and high fever. Nurse providing care for a patient with shingles understands that the illness is caused by reactivation of which of the following virus. Already we have discussed in the case scenario itself. It's not cytomegalovirus, it is not Epstein-Barr virus, but it is varicella zoster virus reinfection. Human, and it is not HIV virus also. So the answer is varicella zoster virus. The nurse includes which information in the teaching plan about the management of this shingles? Is it limit fluid intake, encourage bed rest, post-herpetic neuralgia may develop, take antibiotics as directed? So the answer is already given. It is the post-herpetic neuralgia will develop in the patients with shingles. So in the teaching plan we need to include that. Long-lasting post-herpetic neuralgia, that is the persistent pain can develop with a shingles infection. Bed rest, it is not encouraged as active ambulation is very important to prevent the lung, skin and bowel problems and the deep vein thrombosis problems. So we should not encourage bed rest. There is no need to limit the fluid intake, we need to increase the fluid intake, and antibiotics are not indicated for shingles as this is a viral infection. So here we need to teach about the persistent pain. Which statement by the patient indicates that teaching has been effective? I'm so glad I can continue my exercise schedule. I need to stay away from my aunt who had a kidney transplant. So I should contact you if I have more blisters appear. I don't drink a lot of fluid, so it shouldn't be hard for me to limit my fluid intake. So people with a compromised immune function such as a renal transplant, or if the other patient on immunosuppressive drugs, they are more susceptible to get this shingles infection. So we should take care of those particular patients. Blisters, they are common presenting symptom. They do not need reporting after the initial assessment. Of course, for the initial assessment we need to see the blisters, but after that it's a common presenting symptom. Then fluid restriction, it is not required, and the maintenance of a normal schedule as long as the patient is comfortable can be done. So here we should tell, if the patient tells the patient need to be away from the aunt who had a kidney transplant, that means the patient understood about our teaching. Thank you so much. Hope you understood about the assessment of the immune system. Please do watch for more videos.